So I'm going to be moving from geriatrics to children and youth. And as Ryan said, my name is Sarah, and I'm talking to you today about my thesis, and it's on predicting children's language abilities. So in a nutshell, I'm taking a holistic view including behavior measures of parental abilities and family and environmental factors that influence a broad spectrum of children and their language abilities. So typically when you're a baby, you start learning language with responding to nonverbal gestures of communication. That's things like smiling and just making gaga goo goo noises. And then throughout the first few years of life, you begin to develop words and you master syntactical rules and grammaticality, judgments. So typically, or quite often, a lot of people develop language with relative ease. However, there are a significant proportion of children who do have extreme difficulties. And these people have immense struggles throughout life. They struggle with their social behavior, their academics, and their family functioning. So you might think to yourself, why do kids learn language differently? Why is this so? And a possible reason is that there are so many influential factors affecting language, starting with cognitive functions, things like remembering information in your brain for a short period of time, or how much you can actually store at once, and also how much you can store and process information at the same time, which is called working memory. There are also a lot of environmental factors that affect language learning. So this may be from the type of parenting style you're exposed to. For example, if you have more of an assertive parent who is more directive, that might not leave as much room for discussion, which could affect your ability to hold a conversation, for example, or even just start putting sentences together. Also, things like recreational activities that kids take part in, these help develop their not only social skills, but their language. So there's so many factors that you need to keep in mind. So keeping some of these factors in mind, the International Classification of Functioning Disability and Health uses or provides a holistic approach to assessment and intervention for things like language learning. And this framework is actually great because it highlights two really important broad categories that are first bio, psycho, and social factors, and secondly, environmental factors. So within the biopsychosocial factors are the cognitive functions that I was just mentioning, and the environmental factors like it assesses how family members treat one another and how they interact and maybe even express themselves. So this is a great framework for my thesis. Moving on to what exactly I'm studying. My first question is looking at how effective measures of parental abilities and environmental factors are in accounting for the variability in children's language abilities. And then secondly, I want to see what exact factors significantly and uniquely affect kids' ability to learn language. So to begin the process of answering these questions, I first recruited my participants from a pre-existing database. The kids are between 6 and 9 years old, and this is because it's a really good age to assess children's development because they already have done quite a bit of development by this stage. And my population was a reflection of the general population within the Thames Valley District School Board. So then the second group are the parent participants. They are the biological parents of the children, and this is emphasized because, as I'll say in a bit, I'm taking measures of things like nonverbal IQ, so that's why it's really important to have the biological parent. So in the end of my data collection, I ended up with 45 parent-child couples, also known as dyads. Specifically, I had 23 girls and 21 boys for the child participants, so that's quite gender neutral, which is great. And I met with only the parents at one time. So this took about, to complete the assessment, it took about 45 minutes depending on the person. And I either met them here in Elborn or I met them in the comfort of their own home. And this was completely up to them. It was whatever's best suit their needs or wherever they were most comfortable, because that's really important. So I took a bunch of standardized tests, and the parents and the children did complete some of the similar measures, and those were nonverbal IQ, which are things like matrix reasoning and block design. Then there's phonological short-term memory, which was non-word recall and sentence recall. And then reading abilities, which tested your ability to read a list of words. The first list, sight word reading efficiency, was words that were coherent. And the second test was the phonemic decoding efficiency, and that was a test of jumble words, like words that just didn't make sense and words that you've never heard of before, and you just had to read as many of those as you could in 45 seconds. So then the parents also completed tests of grammaticality judgment, and then verbal working memory, which was counting recall. And the environment factor that I keep on mentioning was tested by the family environment scale. This was a 90-question true and false questionnaire, and it was divided into 3 major domains, which were personal growth, relationships, and organization and control. These domains were created by the authors of the questionnaire. And then the kids completed a separate series of measures that involved making their own sentences and then recalling sentences, as well as following directions, which seems a little bit easy, but in order to follow directions, you have to understand the words within the direction. So that was what we were getting at. And that series of measures was grouped into a composite language score. And lastly, they did a listening recall measure. So I'm just going to present to you some preliminary results that are the composite language score. So I began by doing a couple of correlation analyses. The first one was just seeing if the parental measures were highly correlated with each other, and they definitely were. And the second one was seeing how the parental measures correlated with the composite language score. And then I did a series of multiple regressions to find the significant and unique predictors that were predicting composite language score. So in the end, these 4 factors, matrix reasoning, non-word recall or non-word repetition, organization and control, and counting recall, significantly predicted the children's composite language score. It came up to, I think, 22% of the total variance. Then I went on to look at the unique contribution of each of these factors within the model itself. And the results showed that matrix reasoning and organization and control were the most significant factors within the model. Matrix reasoning was about 11.6% of the total of the unique variance, and organization and control was 9.1% unique variance. So bringing in to a conclusion, this model is highly representative of the holistic view for assessing children's language abilities. So if we look back, If we look back to this slide, there's the biopsychosocial factors that are emphasized, which are the nonverbal, phonological, short-term memory, and verbal working memory. And there's also the environment factor. So this is a great representation of how learning language is definitely a holistic approach. There's not one domain or one area that needs to be specified. And as a broader picture, this type of model may be able or might be able to be used for like a screening tool. So if a child is not developing their language skills as expected, you could maybe take these models, see what their score is, and if they're maybe underachieving a little bit, you could do an intervention program. And what's really significant about this is that it could prevent that child from having a serious language impairment a few years down the road. And that would maybe limit their or reduce their social behavior effects, maybe increase their academic performance, and really help the family functioning. So it is rather important. That's it. Thank you.